you all have heard this n number of times. So Pankaj sir is with me that every time you go to the doctor, the only answer is please pop a pill every morning. But we are helpless. We do not know what to do. So if I have your permission, I would like to share the screen so that you get to know more and more about Ashtang Chikitsa and how easily you can come out of your health issues. So just give me 2 minutes as I share the screen. So Ashtang Chikitsa online therapy for neuromusculoskeletal problems. Namaskar, I welcome you all to the Ashtang Chikitsa webinar. My name is Rachna Bothra and I'll be your host for today's webinar. I'm a part of an organization called Avisa Healing and Fitness Private Limited. In today's webinar, we will present to you a unique therapy for curing neuromusculoskeletal problems that you or someone in your family may be suffering from but have not yet found permanent relief despite spending a good amount of money and time on various treatments. Ashtang Chikitsa can also be used as a preventive method so that you keep your internal organs functioning at their optimum levels. Are your doctors telling you you will have to take medicines lifelong? Your problem cannot be cured but will only have to be managed. Organs do not regenerate. You Today is the day that you will come to know you may not have to take your medicines lifelong just to manage your disease. And your problem certainly can be cured. Organs can regenerate. Now I'd like to introduce you all to Swami Sri Raj Vibhuji, a rare kumbak yogi. Swamiji has been transforming lives of thousands of people who have not found relief even after years of using allopathic medicine. He's taken people out of chronic diseases like thyroid, BP, heart, diabetes, and even life threatening diseases like cancer. Who is this webinar for? Very, very important question. People who are tired of temporary treatments and are looking for a natural and permanent solution. For people who want to take charge of their health in their own hands and are willing to work on themselves to come out of their health issues. Reversing neuromusculoskeletal problems with Ashtang Chikitsa, freedom from pain and medicine. Ashtang Chikitsa can heal. Of course, the list is endless, I would say, with the current problems. But these are the commonest problems that we come across every week when we start a new batch. Knee pain, lower back pain, hip issues, pain in the leg, drop foot, spine related issues, slip disc, disc bulge, weak spine, spondylitis, frozen shoulder, drooping shoulder, tennis elbow, rheumatoid arthritis, osteoarthritis, osteoporosis, dislocation, neuropathy, or the nerve issue. Ashtang Chikitsa can further heal certain chronic issues like muscular dystrophy, multiple sclerosis, TMJ disorder, varicose veins, psoriatic arthritis, Ehlers-Danlos syndrome, spinal stenosis, myasthenia gravis, Bell's palsy, cervical spondylosis, carpal tunnel syndrome, ataxia, Guillain-Barré syndrome, ABN, Alzheimer's disease, dementia, glaucoma, vertigo, ankylosing spondylitis. All these diseases that we just talked about are degenerative diseases, which means that the organs are becoming weak. So, a long term or permanent solution is possible if we can increase the regeneration factor of the body. No medicine can regenerate the organs, be it allopathic, Ayurvedic, homeopathy, or any other medicine. In today's webinar, you will discover the one and only method that can regenerate the internal organs. Let's hear from Swami Sri Raj Vibhuji. Please pay attention to what he has to say about the human body and the diseases because you will not find this information anywhere else. Through his knowledge, thousands of people suffering from chronic ailments have transformed their lives completely. It can change yours also. Thank you so much for listening to me patiently. Now, I would like to let you know how we are going to proceed in the webinar. After this, you're going to listen to the recorded video of Swamiji, where you're going to get an insight of how the human system works and how you can lead a medicine-free life just with the help of your own breath. After that, we are going to share the online program details. Then we are going to share a recording of somebody who's been a part of the Ashtaang Chikitsa program. Last but not the least, we will be taking up your questions. So please take your virtual seats, let there be no disturbance from pets, children, etc., and put full ears to what Swamiji has to say. There might be certain things which you might have to unlearn and learn certain things. Thank you so much once again. Namaskar, and over to Anilji to share the video.
Just give me a few seconds.
Anilji, the sound is not coming. Please give us some time. We are playing the video. There's been some problems.
We can't hear anything.
Yeah, just please give us 2 minutes. Yes.
So, what we are doing? We are doing kumbak chikitsa or kumbak therapy. Anybody who has heard this name kumbak before? Have you ever heard this name kumbak? People into Yog Kalachara, they might have heard this word kumbak. But what we are presenting is a part of Ayurveda, not yoga. So it will be a little different, right? This is a part of Ayurveda. Now to introduce you to kumbak, are you doing kumbak in your daily life? So let's start from there. Anybody and everybody cannot do any function without kumbak. So let's understand kumbak first and let's see what can kumbak do in your life. So anybody and everybody cannot function without doing kumbak. So let's do an experiment, right? We'll do an experiment. And you have put your cameras off. I don't know whom I'm speaking to. It's when people gather together, it's an opportunity to actually see faces and meet people. And you don't know tomorrow will be there or not. Can anybody guarantee? So enjoy your today. If possible, put on your cameras. Clasp your fingers. Clasp your fingers. And pull hard. Pull hard. As hard as possible. How you creating this strength of pull? Relax. How you are pulling. How you are pulling. Lot of things might be coming to your mind. Using the strength of your muscles, using your conviction, using your mind or whatnot. But you are not looking at the right point. So let's do it again. And wherever I am indicating, look there. Let's do it again. If you do the experiment, you will know what I am talking about. So everybody should participate. Pull hard. And see, the more hard you want to pull, the more you have to hold your breath. Yes or no? The more hard you want to pull, the more you have to hold your breath. Can we now push? Can we do a pushing experiment? Push hard. And see, the more hard you want to push, the more you have to hold your breath. Yes? Yes? Now pick up a point in front of you. Pick up a point in front of you. A small object or a point in front of you. And try to focus without distraction. Focus on that point. Focus on that point. Become absolutely still and focus on that point. The more focus you want to create, you'll see your breath will become shallow and it will hold up. You know, you can relax, you can relax. I don't know if you had breakfast or not. You had breakfast? You had breakfast. Okay. Just remember clearly with your closed eyes. Remember clearly in detail what kind of breakfast you had in the morning. Close your eyes and try to remember in detail the colorful imagination. See, even if you have to remember, you have to hold your breath. And then your remembrance becomes better. Okay, relax. Somebody talked about dementia. What is your problem? Why you are not able to remember? Because you are not able to hold your breath. Now, if you have to balance yourself, stand on one leg, or somebody is pushing you. You want to stay on the ground. You want to hold the ground. What do you do? What do you do? Somebody wants to push you and you want to hold the ground. What do you do? You hold your breath. Yes. You want to stand on one leg. Create a balance. How do you create a balance? You hold your breath. Right? How do you dance? How do you sing? How do you walk? You hold your breath in variable proportion behind. Don't notice it. You don't notice it. You hold your breath in variable proportion behind. Walking, jogging, yoga, Zumba, aerobics, whatever you do, household chore, whatever you do, even you have to get up from the chair. What did you do? You held your breath for a short time, isn't it? Can you do any action without holding your breath behind? You can't. The only thing is you are not noticing it. You are not noticing it. So action in life happens because of kumbhaka, the breath hold that you did in variable proportion, at variable point of time, in variable mode, sitting, standing, lying down. What you are doing? You are holding your breath, or you are doing kumbhaka. You are doing kumbhak to do an action. Now in all your problems, in neuro musculoskeletal problems, what is the basic issue that you have? It is inability to do action properly. Yes or no? Any kind of neuro musculoskeletal problem, what is the basic issue that you are suffering from? You are not able to do action properly. When you do action, either you feel pain, or you do not have that kind of strength, or you do not have hold over your limbs. Yes? So let's understand the basic problem. Only if we understand the basic problem and we connect it with something which is practical, you can come out of the problem. Otherwise, in the last 100 years, tell me one person who has come out of arthritis by taking medicine. One person who has come out of rheumatoid by taking medicine. One person who has come out of Parkinson, dementia, and so on and so forth, osteoporosis, by taking any kind of medicine. We do not have even a single proof in the last 100 years that we have come out of these problems by taking medicine. And I am talking about chemical medicine, allopathic medicine. Now one more commonsensical question. Would you put diesel into a petrol engine or a petrol vehicle? No? No, never? Never. So, tell me, was your body designed for a chemical intake? Your body was not designed for chemical intake. For the vehicle, you use your common sense. For human, your body, where does this common sense go? If your body is not designed for chemical intake, your body is not going to become better or healthier by chemical intakes. So where is the proof? All these diseases, are they increasing in the world or decreasing in the world? It's all increasing. All the chronic diseases are increasing in the world. Is there a single diabetic patient who has come out of diabetes by taking medicine in the last 100 years? One blood pressure heart disease patient? Do you know blood pressure and heart disease has become the #1 cause of death? Thyroid patient, have we been able to cure any thyroid patient? Autoimmune disorder patient? Cancer is increasing at the rate of 12% every year. Arthritis, rheumatoid, and you listen to all those problems. Neuro musculoskeletal problems. even a single patient hasn't been able to come out of these problems by taking chemical medicine. In fact, the data says these all problems are rampantly increasing in the world. So it is high time that we look in some other direction. We think out of the box. With a different kind of a false narrative, you are not going to become better. You start with one medicine, and how many medicines you have come up to? Now, if we understand this body, we can understand how we can reverse our problems. The whole purpose is to reverse these problems. So one example, the core key of how to reverse your problem, I have given it through an experiment. So whenever you make effort, you use kumbak. Now effort happens with your neuro musculoskeletal system. You use your breath hold to integrate your neuro musculoskeletal system to make an effort. Right? So if your neuro musculoskeletal system do not get the proper regeneration and degeneration, you will not be able to make right effort or proper effort. What I am talking about is regeneration in the body, new tissues forming, and degeneration of the body, old tissues going out of the body. This is a continuous process that is happening in the body. So let's see, is this regeneration and degeneration, the balance of this has deviated in the world? So what is your knee problem? What is your knee problem? The regeneration of cartilages are not happening. Myelitis, or what you call as myopathy, muscle loss, muscle weakness, what is that? The regeneration is not happening properly. The arthritis factor also happens because of lot of toxins at the joint. The degeneration is not happening properly. Toxins are not getting removed from the body properly. So this regeneration and degeneration is something that we have to get into balance. How many people you see are overweight or underweight in today's world? This problem is huge in the world, isn't it? Either the people are overweight or underweight. To maintain the right weight balance has become difficult in the world. Yes, isn't it? Yes. What is the basic problem? It is the imbalance of regeneration and degeneration. In Ayurveda, the rate of regeneration and degeneration is called as Vata. There is a word for it in Ayurveda. The rate of regeneration and degeneration is called as Vata. The energy of regeneration and degeneration is called as Pitta. And the material management in regeneration and degeneration is called as Kapha. So Ayurveda says, if there is a deviation of Vata, Pitta, Kapha, you will get into neuro-musculoskeletal problem. I'm generalizing it any kind of neuromusculoskeletal problem comes under what I am describing. So, I will describe it in another way also. But let's first talk about regeneration and degeneration. Now, this regeneration and degeneration depends upon what? It depends upon your body's ability to utilize food. What you term as metabolism. Your body's ability to utilize food. The food that you eat, the body should be able to utilize it to create new tissues, to create muscles, to create bone density, to create nervous system or nerves. Now this metabolism has gone weak in the world. What is the proof? Do you know Neuro Musculoskeletal Problem is a metabolic disorder? Do you know diabetes is metabolic disorder? Do you know heart disease is metabolic disorder? Thyroid is metabolic disorder. Cancer is metabolic disorder. Any kind of chronic disease has a metabolic disorder in its core. Even your immune system disorder, autoimmune disease and other immune disorder, metabolism is a precursor to any immune system disorder, and they work inversely proportional. If your immunity is high, your metabolism will come down. Your immunity will go high when your body will get into some kind of risk. Do you think when you put a chemical inside the body gets into risk? Your body is not designed for chemical intake. When you put a chemical medicine into your body, the body gets into risk. It enhances, increases the immune system and downplays the metabolic system. All metabolic disorder is increasing in the world because of chemical medicine intake increasing rampantly in the world. One major factor of why you have got into neuromusculoskeletal problem is from childhood you are taking in chemicals or pushing chemicals inside the body. In the name of vaccination, in the name of doing something good to your body, you are actually doing a criminal act with the body. And obviously, the health quotient of the world cannot increase because of your destruction or destructive activity on your own body. I'll give you one example. All of you must have some quantity of medicine at home. Everybody has paracetamol, yes or no? You have paracetamol or some kind of painkiller in your home, in your first aid box, right?
Yes.
Now what
Yes.
does, I'm just trying to make you understand. It is very important that you get it right. If you understand the whole thing clearly, then only you will be able to take a right decision towards correcting your system, isn't it? What you do in your life is your freedom. But you must get it clear in your head first. So, there are two kinds of painkillers. One is called as steroids. The other category is called as NSAID, non-steroidal anti-inflammatory drug. Your paracetamol, nimesulide, there are many, ibuprofen, aceclofenac, diclofenac, all these comes under NSAID. Now they do this pain relieving activity by inhibiting a biocomplex called prostaglandin. Prostaglandin inhibitors. They are called as prostaglandin inhibitors. Now prostaglandin, what it does? Prostaglandin activates the regenerative factor in your body. When you are taking a painkiller, you are saying, I don't want new tissues in my body. When you are taking a painkiller or you are trying to put down your fever, you basically are saying, I don't want regeneration in my body. So what will you get? When you take paracetamol, what will you get in the life? Arthritis, rheumatoid, myasthenia gravis, dementia, tendinitis, carpal tunnel syndrome, and so on and so forth. Because these are all degenerative disease. What will your body do if it has to kill a virus within itself? Everybody of you must have gone through some kind of cold and cough, viral flu or corona. In your life, you must have gone through all these cold and cough, viral flu, some kind of a viral infection. What happens when you get cold and cough? What happens first in your body? The body raises the temperature, what you call as fever. The body raises the temperature. By increasing the temperature by 5 degrees, the virus will get killed. But the moment body raises temperature, what do? Paracetamol. You are saying, I don't want you to kill the virus. So you want to treat yourself by taking medicine. If you don't take medicine, the viral will go off in 3 to 5 days. But if you take medicine, it will go off in a week to 15 days. But we are intelligent people, you know. We want to give credit to some medicine. So a week and 15 days is okay. Because if you would not have taken the medicine, you would have been treated in 3. You would have become well in 3 to 5 days. But we are intelligent people and we have to give credit to the recovery to some medicine. We choose a longer path. Okay, we'll become fine in 10 to 15 days, so we take medicine. Despite of your taking chemical intake, you are still living and breathing. Just pat your back, appreciate your body at least. With so much of torture, you are still living. This body is such a resilient entity. You have tried to kill it in every possible way, still it is living. It's a miracle. It's a miracle. You are trying to stop or activate every function within yourself, within the body. The body knows how to survive, how to do action. Are you doing the heart activity inside the body? Your own body? Are you doing it? Are you conducting it? Are you conducting any function inside the body? Doing the heartbeat? You are not doing it. You don't know how it is happening. Liver function, are you doing it? Kidney function? Neuro function? No, you are not doing it. But you feel it is my right to stop any function inside the body or deviate any function inside the body. You take in a chemical. These chemicals are called agonist or antagonist. They either stop a function or deviate a function. So we have tried to kill this body in every possible way. If it is still surviving, it's a miracle. It's a miracle, isn't it? You must at least appreciate the sturdiness, the robustness of this mechanism, which is human body. Okay, so I just gave you a hint of what we are doing. Don't go on narrative. You all are intelligent species. Use your wisdom rather your information or education. Please use your wisdom. You are all intelligent people. Don't always agree to what somebody says. There is a wisdom of life there which is alive in you. If you think from that wisdom, you can see this very clearly. So, Vata Pitta Kapha. Now I'll talk about Vata Pitta Kapha in a way where we can actually correct it. So, the whole system or any living entity functions on three factors, which is Vata Pitta Kapha. Of course, I described it in a different manner. Now I am describing it in a different manner. First, the most powerful aspect which is needed inside your body is pressure. Pressure. Because action always happens in pressure gradient. So even if the cloud has to pour somewhere, you have read this rain cycle. From the sea, the water has to rise and become cloud. Then the cloud moves from high pressure to low pressure zone and pours down there. So even the cloud movement happens in a pressure gradient. From lower down in a tree, the tree has to pump water and mineral and all the food up. That happens in a pressure gradient from a high pressure to a lower pressure zone. In your body, food moves into your cells and out of your cells in a pressure gradient. You have to create an osmotic pressure. Your body has to create an osmotic pressure of the tissues and cells for proper intake and exchange of materials and gases and water. So your body functions in the right kind of a pressure ecosystem or architecture. If this pressure architecture goes down, your organs will not function properly. The absorption will not happen properly. Metabolism will not happen properly. Exchange of water, gases, and nutrients will not happen properly. The right kind of pressure has to be generated in the body. Now I'm giving you one more example and proof to understand this. Just imagine your grandfather, grandmother. Just imagine your grandfather, grandmother. If you compare your grandfather and grandmother with yourself and think of the same age line, at the same age, what is the difference between them and you? One common difference. You can say they were not into these many problems. Yes, but what is that factor because of which they were not into all these chronic disease? They could make more effort with their body. You can't make that much of an effort with your body in comparison. They could do lot of things at a particular age with their body, make lot of effort. At the same age, you are not that efficient comparatively, isn't it? What we have lost through the ages, we have lost the capacity of effort making, of making effort. Our capacity of making effort is less than their capacity. So what you have lost fundamentally, if you have lost effort making ability, you have lost the capacity to hold your breath, because you make effort by holding your breath. Yes or no? Are you getting it? Are you with me? We have done an experiment. If somebody has joined later, they can watch the webinar again, because it is very important that you understand things. Only then your life will become better. It will not become better with ideas and narratives. So what you have lost in 2 generations, the ability to make effort with your body. That means you have lost the ability to hold your breath. Do you want to improve your life or not? Do you want to improve your effort making ability or not? Do you need a kumbak practice or not? Let me tell you, this is the only way through which your life experience, the quality of life will improve. There is no other way. If you think some medicine can improve your life, you are daydreaming. It will never happen. You must increase the body's ability to make effort. Now, what is metabolism? What is metabolism? The body's ability to utilize food. Now, take an example from your life's experience. You know, in your life, whenever you did lot of activity, that day you get lot of hunger. You become more hungry, isn't it? The more you become hungry, the more the body utilizes food. So with lot of effort in your young days, whenever you did lot of effort, lot of work, you became more hungry that day, you ate more food and your body utilized more food. How did you do that activity? Whatever activity that you did, by holding your breath in variable proportion. When you did kumbak, your body's ability to utilize food and your hunger increased. So kumbak increases metabolism. And we have a lot of proof of that. There are thousands of people who have done kumbak and they have improved their metabolism. Their regeneration capacity has increased. People with lot of degenerative disease They have come out of those diseases. People have come out of degenerative neuro disease also. Paralysis. People have come out of paralysis. Drop foot, myasthenia gravis, lockjaw, frozen shoulder. And we always say, even in the case of Parkinson, there is only one way in which you can improve your condition, and that is by doing kumbak. So first thing first, your metabolism has to improve. The moment your metabolism improves, the autoimmune factor of the body balances out. So whenever you take a pill or take some food which is deviated, genetically modified, hybrid, processed, inorganic, your body gets into risk. So it increases the immune quotient, the immune factor, the metabolism goes down. Whenever you take medicine, the immunity increases, metabolism goes down. We have deviated the environment also. Even with your breath, when you are breathing, your immune factor is trying to push up and your metabolism trying to go down. No doubt, all the metabolic diseases are on rise. They are becoming epidemic. So first thing first, you have to increase your metabolism. And that will happen with kumbak. With kumbak, you can increase your metabolism, and you'll see the moment you increase your metabolism, the autoimmune factor which is there inside the body, it goes down. It balances out itself. So even rheumatoid arthritis or any kind, Hashimoto or any kind of autoimmune syndrome in the body, it gets balanced out. It can become, you can reverse those things. By taking in steroid, you will get into more and more problems. You should only take chemicals in a very emergency situation and for a short period of time. You should only take medicine when the condition is at a very high risk, and that too you should take it for a short period of time. Then you should ideally work upon the body in such a manner that your body's recovery strength, regenerative strength, metabolic strength, immunity, hormonal balance, detox strength, they improve. And the body should be able to take care by itself, because your body is designed for it. It can take care of anything by itself, but that strength has become very weak. So by kumbak we can increase all those strengths. So you should be working upon the body. If you start doing kumbak, you should work upon the body for at least 6 months. For 3 months continuously, if you work, you can reduce 50% of your chemical medicine and take some alternative natural medicine. After 6 months, you decrease that 50% of chemical also to null. 100% of what medication you should be taking has to be natural, without any side effect, those kind of medication. Herbal. After 1 year, no medication at all, because your body is designed to take care of itself. You don't have the recovery strength. That's what we will increase through kumbak. Now, you can't change the environment. The second factor, I'll talk about 3 factors and then we'll go towards the question answer session. We'll tell you a little about the course. So the second factor, with every chemical, you get a side effect. You get an adverse drug reaction in the body. Right? Now, it doesn't happen with just chemical intake. It happens with the deviated food intake also. It happens with the deviated environment also. Now you can't change the environment overnight. You should start changing the environment today. It will take 200 years. So what you should build is your tolerance toward a deviated environment. To build a tolerance toward a deviated food. To build a tolerance towards the adverse drug reaction. If you are tolerant enough, you will get less damage in the body. You can reduce the damage. You can reduce the adverse drug reaction. You can reduce the impact, the side effect of those things, isn't it? So how do you tolerate things? Now suppose you lift a 10 kg weight. You lift a 10 kg weight. How do you lift it up? How do you tolerate it? You hold your breath, isn't it? Can you lift any weight without holding your breath? No. The more weight you have to lift up, you'll have to hold your breath more. So you tolerate things by holding your breath. Suppose you have to now lift 20 kg weight. So you have to hold your breath even more, isn't it? How do you tolerate weight? 10 kg weight? By holding your breath in a certain proportion. Now if you have to lift 20 kg weight, you will have to hold your breath even more. Are you practicing it? No, you are not practicing it. You are not doing kumbak. So how will you ensure that you do the risk in your life, the future risk gets reduced in your life? How can you ensure then? If you do not improve the tolerance of this body. By taking medicine, you will land up in a hospital one day. That is for sure. And the organ damage will happen one after another. You have to ensure that you tolerate the wrongs, the side effects of whatever we are consuming at this point of time. Not only consumption, but the environment also. So if you have more tolerance, you will be saved. Otherwise, there is no chance. Right? Second part, I have told you. Tolerance. That's how your future risk and the tolerance to all the wrongdoings will increase. You will get less damage. Okay. So, metabolism you have to improve. Kumbak will improve. Tolerance you have to build. That kumbak will do. Third thing. What is the greatest weakness in your body which has created all the damage? Do you know it? You actually don't know. What all your diagnostics do is basically measure the symptom that is happening. But why the damage happened inside the body, nobody can actually scan it, diagnose it, do any test of it. The diagnostic system, the current diagnostic system cannot even tell you 1% of the total things that is happening inside the body. So it is insufficient. We have to do some other kind of diagnosis which can tell us the root weakness in the system and work upon it for a faster result. So that is why we do the world's only Prana Shakti diagnosis, which actually diagnoses the weakness in the functional capacity of human body, a particular functional capacity. So we tell you to do a little experiment with your breath. with a little experiment with your body and emotions and fill up the form. Those results actually help us to come to a conclusion of what functional aspect of your body has become weak, because of which you have got into a particular problem, and then the other problem also came along. That is what we take as a basis to customize your module. We teach you a generic module. All of you will be taught a generic or the same kind of a kumbak module, and after diagnosis we'll customize it as per your body. So everybody's kumbak module gets customized according to the problem the person is facing, because all of you don't have the same problem, isn't it? You have all different problems, and it has progressed into multiple issues also, but something might have started first. So we do a diagnosis, a different non-invasive world's only prana shakti diagnosis, which actually tells us the functional weakness of your body, right? We don't test ingredients, we don't test levels, we test the functional weakness of your body, and we customize the module according to that, so that you get a faster and a better result. So pressure I talked about is one thing through which you do action. The temperature of your body also has an ability to treat you or and keep you in a better health. That is called as pitta. Pressure and temperature actually does the material management of your body. So pressure is called as vata. Pressure also generates or regulates the temperature of your body. So it is called as pitta, the temperature factor. And the third factor is kapha, which is basically material management, which happens because of pressure and temperature. So this is vata, pitta, kapha. The most powerful way to correct vata, pitta, kapha is regulating the pressure. You can regulate the pressure by breath hold only. There is no other way. So we control the vata. The vata is controlled by pressure. The pressure also regulates the pitta, temperature of your body. So vata pitta gets controlled. Vata pitta together controls the material management, the kapha factor in your body. The regeneration, degeneration thereby gets into balance, right? So just by two factors, regeneration, degeneration, I have explained how it can be corrected and what are you doing to correct it, what is the right approach, what you are doing, how it is a wrong approach. You can take a proof of evidence of the numbers, the data of people into disease and how much it is increasing day by day. From there you can have the evidence of what I am saying. And you also know it through your own experience. So the experiments that we did, it's all into your experience. So we have to look at the health of humanity from a completely different perspective to actually reverse it, come to a state of health and happiness. Right? I'll stop here.
Thank you so much for listening to Swamiji patiently. Now I would like to request Anandji to please share the program details with us.
Just give me a few seconds.
The doors will be open.
Are you able to see the screen, Rachna?
Yes.
Okay. So let us know about the Ashtaang Chikitsa online program details now, because a lot of people may be waiting for this. It's a guided program which is conducted online by trained kumbak mentors. Just like you are attending this webinar on the Zoom app, in the same way the classes will be conducted, and these mentors are trained by Swamiji himself. Now, as you must be knowing by now, there are three modules in the program: Vata, Pitta, and Kapha. Duration of each module is 21 days or 3 weeks. So, 3 weeks into three modules makes it a 9-week program. But you see, there's 1 week added to these 9 weeks, 9 plus 1 week. So, why 1 week has been added, that we'll talk about shortly. There'll be a total of 18 classes, two live classes per week for 9 weeks. Out of these two classes, one is called the main class and the second one is called the practice class. What is the difference between the two, that we'll also understand. What are the next steps? You can pay the program fee, and there's a special group fee we'll be announcing for people who are attending it live. Then you'll be filling up a participant onboarding form so that we can create login credentials for course access. Course access means the access to all the class recordings. And then you'll be starting your classes with module 1. Module 1 is Vath module. After completing that, you'll be going to the next module, which is the Pitta module. And after completing that, you'll be going to the last module, which is the Kapha module. One by one, all three modules have to be completed. Total classes, module 1 has 6, same for module 2, same for module 3. So 3 modules into 6 classes per module makes it a 18 class program. But then if you see written in white, there are 3 refresher classes. After every module, there'll be one extra refresher class also. And then there'll be one customization class in the 10th week. We'll talk about this customization in detail and shortly. So total of 22 classes will be there in this program. What are the class start date? Batch 280, it is starting on 18th August, 7 p.m. Dubai time. Classes will be on Monday and Wednesday. We'll share all the class dates in the chat and in the WhatsApp group also. What is the class experience like? As you must have understood by now, these are live classes on the Zoom app. Mentors watch all the participants, so it will be compulsory to keep your cameras switched on during the classes, because we have a backend team apart from the main mentor. We have other team members who zoom each and every participant to see how you are doing your practices, how you are performing kumbak. So if they need to correct you, they'll be correcting you in the live class only. Then written instructions will be there in English and Hindi, which you can download and print also. Session recordings will be provided to you. These are recording of the live classes. Then there'll be a lot of extra things like mental practices will be there, and you'll get a unique diet perspective. Mind you, this is not a diet plan, and there are no dietary restrictions while doing this therapy. You can continue having the kind of food that you're used to eating, but through this diet perspective or food perspective, you'll get a video from Swamiji in which he talks about how to use food so that it supports the body and not harm it. And again, I'll repeat, there are no dietary restrictions while doing this therapy. Then there'll be simple detox processes that you'll be given, and a lot of knowledge will be shared during these 9 or 10 weeks that you will be with us. Before I share more details, it's very important to know who this program is not for, or who all will not be able to do this program. This is not for people who are looking for a magic pill and want results tomorrow only. If you're looking for any kind of medicine, then this program does not have that kind of any kind of medicine. And this is not for those who are not ready to work on the body, because you'll be required to invest 45 to 60 minutes every day to do your kumbha practices. If you do not have this kind of a time, then also you won't be able to take advantage of this. And it's not for those who are impatient. We understand when you're into pain, into chronic ailment, the patience goes down, but still, if you are able to maintain patience, then you'll be able to reach to a long-term solution or a permanent solution. And it's not for those who are looking for a free treatment or just some tips. Many people misunderstand that the therapy is free, because what we advertise is that it's a free introductory webinar about Ashtaang Chikitsa. But many people understand that the treatment is free. This cannot be free because it is to be done under the supervision of trained kumbak mentors under their guidance. And if you are here to pick up some tips, then you must have noticed Swamiji didn't give any tips. Neither are we going to give any tips, because any kind of a permanent solution or a long-term solution does not happen through tips only. Through tips, you may get some temporary relief, but a permanent solution is not possible, because if it were the case, you would have already solved your problem, because there are thousands and thousands of videos on YouTube and other places, thousands of experts giving thousands of tips, but still we haven't been able to solve our issues. And now let's talk about what all you get in the program. What is Pran Shakti diagnosis? How it is conducted? We'll talk about in as much detail as possible in the limited time that we have. So let's talk about Pran Shakti diagnosis, which is the magic of this therapy. Why we say the magic of this therapy? Because through this diagnosis, and Swamiji talked about briefly in the video also that we just played, through this diagnosis, he's able to determine the weak functional strengths on the body, in the body. And like Swamiji said, we don't measure levels, we don't measure ingredients. It's the weak functional strength or the weak organs due to which you have landed in your current health issues. And it's a diagnosis, one of its kind on the whole planet, because it's a non-medical diagnosis and it's a online diagnosis. Now let me explain how this is done. You'll get a link to a form and you'll be asked to do some experiments on your breath and emotions and note the observations in this form. Second, you'll be writing about all your health issues in this form in the order that the problems occurred in. Like you'll be writing this problem had happened first, 3 years back, 10 years back, 20 years back, then this, then this, then this. In this order, you'll be writing. And third, you'll be uploading a selfie photograph, shoulder and above, in which the face should show very clearly, but no specs on the eyes. And in case of ladies, no makeup also. When these three things reach Swamiji, he is able to determine the weak functional strengths in your body. And based on this, he'll customize your therapy in the 10th week. I'll talk about that very soon, just after a couple of minutes. This is Pran Shakti diagnosis. Because see, if we are not able to find the root cause, we'll be guessing only. Like a lot of therapies do that. If this is not working, then they'll change the therapy, they'll change the medicine, they'll change the treatment. So a lot of experimentation keeps on going, and maybe you've been a part of that also. Now weekly one main class will be there of 45 to 60 minutes. Weekly one practice class of 45 to 60 minutes. Now what is the difference between the two? In the main class, the mentors will demonstrate how a kumbak practice is to be done, because every week new kumbak practices will be added to your daily routine. So the mentors will demonstrate how a kumbak practice is to be done. Then in some of the classes, Swamiji's videos may be played for some more for more depth of understanding. And in the end, there'll be some time left in which you will be doing the practice. This is the main class. And in the practice class, as the name says, it will be complete practice only. You will be practicing along with the mentor. Access to recordings of the live classes will be there for 3 months. After the 10 weeks, after your program is over, the access to all the class recordings will remain with you for 3 months. During this time, you can watch again and again, even make notes also. And if you're practicing on a daily basis, after a time, muscle memory will build, and then you'll be able to do without any watching any video or without even consulting or referring to the written instructions. Then videos of all kriyas done in the class, these will be small videos. One is the class recording, the whole 60 minutes of the class. Then these will be small videos. Some video may just take 2 minutes to watch, 5 minutes, 10 minutes to watch. So this will save a lot of time. The written instruction in English and Hindi you can download, and these will be very handy. These will come very handy when you're traveling or when the internet is slow, because that time your videos may not play properly, but if you have these written instructions in the printed form or in your device on your mobile phone or your laptop, you'll be able to do them every day. Then this is the most important part of the support system that we provide, private WhatsApp group or the class group that we call it, to ask your doubts and questions in. Like I told you, there'll be 2 live classes per week. The remaining days of the week, you'll be practicing on your own. And while practicing on your own, if you have any doubt, any question to ask, this is the place to ask them in. Our mentors, they'll be there in these groups. They'll be answering all your questions, clarifying all your doubts, and they'll keep on guiding you in a step-by-step manner. That individual participant progress tracking and feedback after every module. Like there are 3 modules in this program: Vata, Pitta, and Kapha. After each module, you'll be filling up this form. Through this form, we come to know if you're making progress or not. And if someone is not making any progress, we try to find out the reason. We try to find out if you're doing the practices daily. We try to find out if you're doing the practices correctly as instructed. This is very, very important. And therapy customization for each participant in the 10th week. Please pay attention to this because this is super important and this is connected to the first point. Do you remember the first point we talked about? Prana Shakti diagnosis for root cause determination. Now, the Pran Shakti diagnosis will be done in the first 7 to 10 days, but this will be used in the 10th week. Now, a question arises, if the diagnosis is done in the first week or in the first 10 days, why the customization is done in the 10th week? There's a reason behind it. Let me explain. These customized practices are really powerful, and if given in the first week only, initially only, your body will not be able to bear the impact of these practices. So in these 9 weeks, the body is first prepared to receive these customization because there's already internal organ weakness. So in these 9 weeks, your body is brought to a level where you'll be able to do these customized practices, which are really powerful, without any problem. This is the reason that these are given in the 10th week. Then you get
Hello.
specially recorded audio instructions which you can just listen to and do your daily practices. Many people, they tell us that this is very useful because they just play these recordings on their mobile device or laptop and they just keep doing the practices alongside the instruction. You don't have to watch any video, you don't have to read any instructions, just listen and do it. This also saves a lot of time. Then there are a lot of program reviews and testimonials which you can find online. If you go to Google and type Avisa Healing and Fitness, you'll be able to see about 226. I last checked 3 weeks back, and average star rating of 4.8. And once you go there, if you read through them, most of them will be really, really long reviews because people, they want to talk about it, they feel good about it, they feel happy about getting the results, so they write a long, very long reviews. You can go and have a look. And if you want to see some video testimonials, you can type Avisa Healing in YouTube and you'll come to this green logo, which is our channel. If you go there and if you go to the playlists and click on Ashtaang Chikitsa testimonials, you'll be able to see more than 500 video testimonials. And for your information, only 10% of people give testimonials because most of them do not want to talk about their health issues publicly. But these people, they were brave enough to inspire others, to give confidence to others, and that's why they shared this. So just go there, have a look, listen to them, and you'll be able to get more confidence because we understand that for most of you, kumbak is something which you're hearing for the first time, and so it makes sense to go for it and do a lot of research. So you can do your own due diligence. And let's talk about the course fees. A lot of you must be waiting for this. Ashtang Chikitsa, we have 2 arrangements. One option is for one-on-one personal classes. Second option for group classes. Let's talk about the one-on-one personal classes. In the one-on-one classes, there'll be one instructor and one participant. This is for people who want more attention, or they don't want to somehow get into a group. whatever your reason is. So one instructor will be there just for you. The fees for this is INR 60,000, and the time of these classes will be mutually decided as per your choice of time and the availability of the mentor at our end. Now let's talk about the group classes. The normal fees is INR 21,000, but like I said initially in the beginning, that there's a special fee for people who are attending it live. So instead of 21,000 INR, it's just 15,000. It's a special webinar fee which we announce in the webinars only. And these are the different currencies. In dirham, it's 631. Kuwaiti dinar, it's 53. 627 in Qatari Riyal, Omani Riyal, it's 66. And then dinar, Bahraini dinar, it's 65. Let's recap what all you get in the program. Pran Shakti diagnosis for root cause determination, through which Swami is able to determine the weak functional strength in the body, due to which you have landed in your health issues. Then weekly 1 minute class of 45 to 60 minutes, weekly one practice class, access to recordings for 3 months, videos of all PS done in the class, written instructions, private WhatsApp group to ask your doubts and questions in, individual participant progress tracking, therapy customization in the 10th week, and the audio instructions. How to enroll? First step is to pay the program fee. Then you can post the payment receipt in the WhatsApp group. This is the same WhatsApp group from which you got the link to attend this webinar. After that, you will be filling up a participant onboarding form, which Neha from our team will be sending you on your personal WhatsApp number. Then she'll also send you the class join link, through which you will be able to join the class WhatsApp group. This is the same group where you will get daily support, where you will be able to ask your doubts and questions on a regular basis. And step 5 is to start attending classes to learn Ashtaang Chikitsa, simple 5-step process. These are the payment methods, all the payment methods. For international payments, you can use your credit card or a PayPal account or a site called wise.com, whichever is most convenient to you. Again, I'll share the batch start date. It's starting on 18th August, 7 p.m. Dubai time. Classes will be on Monday and Wednesday. Uh, this is the world-class support team that we have, uh, who will make sure that you are able to do this program successfully. Like 9,000 plus people have already done in the last 4 years. We have Rachna Shilva Bothra. She is the program director and the host of this webinar. Shalini Bhagwat is the class manager. Neha Upadhyay is the enrollment in charge. Manager IT is Ashwini. Then we have a team of mentors: Ranjana, Soni, Aruna, Neena, Meera, Sushma, Malvi, Anjali, Ganga, Arijit. And in technical, we have Sheetal. Sheetal is the person who will help you if you face any problem with technology, like if you're not able to log into your course dashboard, if your video is not playing, if your audio instructions are not accessible. She's the person who will be helping you with all these issues. Then in personal support, we have 3 members: Anita, Kavita, Mehak. They'll call you on WhatsApp to find out how your program is going on, or they'll message you if you're not able to talk. They'll message you and they'll try to find out if you're understanding everything, if you're able to do your practices easily. So these 3 people might give you a call or a message. WhatsApp admin Anil Chauhan, that's me. I, along with Rachna ji and Neha, will be answering your questions after the webinar in the WhatsApp group. If your question is not taken or answered here because we have limited time, please do not worry at all. Just post the same question in the WhatsApp group. We'll answer each and every question. No question will be left unanswered, and we'll be answering in great detail. So you'll get complete information and clarity. And here comes the unbelievable part. What is that unbelievable part? What happens after the program is over? After 10 weeks are over, what happens after that? Most programs say goodbye when you finish, right? That is normally what you must have seen, but not us. Why? We stay with you for 12 months, which means you are not left alone. How do we do that? 48 live Zoom support sessions can be accessed. Every week, you'll be able to log in to consult with a senior mentor on live Zoom support. We're not talking about chat, we're not talking about emails, we're talking about live Zoom support. You'll get a link and you'll be able to log in and sort out your query, which means There'll be ongoing mentorship and accountability for 12 months after the program ends. And I'm sure you may not have seen anything like this. Support after the program is over. And you'll keep on getting expert guidance, answers, clarity week after week, even after you're done after 10 weeks. So nothing to worry about, because a lot of people, they miss some classes, or during that short period of time, 9 to 10, although it's not a short period, but for some it's short. So they worry, okay, if I don't understand, if I'm not able to do, so all these doubts we have do away with through this 12 months of support. All these I've listed, I've talked about. With Kumbhak, you can put an end to years of pain and suffering. This is possible now. Most of the people that we get into our programs have tried almost everything, every kind of therapy, every kind of a treatment. So when they join this program, they don't come with much expectations. But when they start doing Kumbhak, when they start feeling the changes in the body, when the pain reduces, when they're able to have more energy, when the inflammation is going down, when the joints are getting more flexible, when the muscles are getting softer, when the skin is glowing, and a lot of changes that they start feeling, then they realize this is something totally different for whatever they've tried before. And you can escape the side effects of allopathic medicines. Very, very important, because a lot of you present here may have you know experienced or still suffering from the side effects. And with Kumbhak, you can empower your body so that it can heal itself without medicine. That is the goal here, to correct your body. Body knows it, but we have disturbed the body's capacity, the body's intelligence to heal itself, by intervening in its functioning, by putting in chemicals and doing invasive surgical procedures. So now is the time that you can do away with all the side effects, all the things that are not good for your body, right? So we invite you to enroll and get benefited by this amazing therapy. And if you've got questions, we are here to answer them so that you get more clarity and confidence while enrolling. Thank you for listening to me patiently. And now I hand over the webinar back to Rachna.
Thank you so much, Anilji. So I will be now playing a video of a participant who has been a part of Ashtaang Chikitsa. So just give me 2 minutes as I share this screen.
Fibromyalgia pain. Fibromyalgia is inflammation in the muscles all over the body, and I have been under treatment since 2012. And morning when I used to wake up, I used to feel as if a roller went over my body the previous day. It used to be that painful. Waking up in the morning used to be that painful. And so that's one source of pain. The other source of pain is I have 9 herniated discs, okay? L4, L5, D9, D10, C6, C7, 9, all MRI confirmed. I had lumbar spondylisis. So that's the third source of pain. And the fourth source of pain is my coccydynia, that's tailbone. It moved from its position. So I have been taking a lot of treatment for that. So after starting Kumbhak from 27th, I would say, 27th of January. So it's only about how many days now? 23 days. Morning, my fibromyalgia pain has reduced by 70–80%. My lumbar spondylisis, my back, I'm getting a lot of strength there. Earlier, after sitting like this for 5–10 minutes, I would kind of want to bend down, you know, my back wouldn't support the upper part of my body. So I feel a lot of strength in my on my back. My lumbar spondylisis is kind of much better. And so all my overall pain, my knee pain, I have very bad knees, a minuscule tear in my left knee and a ligament tear in my right knee. So my knees are like so swollen most of the time, and it's very painful. That is going down, but that is rather slow. The progress on my knee is rather slow, but the progress is definitely there. I can feel it, and I'm feeling so good. I'm scared to share this good news with others, lest it might go away. It might vanish like like camphor. So anyway, and one more thing, tongue, because I have multiple food allergy. I used to always have a white coating on my tongue. So we all like use a tongue cleaner, or just with a brush, we just try to clean the tongue. That would help, but not a lot. So suddenly, about 10 days ago, I was brushing my teeth and I stuck my tongue out to clean it or something. And I found my tongue to be so pink. It was after dinner, it was pink. So I consider my tongue to be it's a yardstick with which I judge how things are inside me, with my digestive system, anything. Like if I eat anything that my stomach doesn't agree with, then that whiteness increases. Okay, the deposit increases. I can tell because it's the indigestion and bloating and acidity and all that, because of multiple food allergy. So now, since last many days, I noticed it 10 days, 12 days ago. I don't know when it happened. It's pink, ma'am, and I'm so happy. I'm like, I can tell that the entire system inside also is working. The last point is I have become addicted to kumbak and whatever the kriyas. I feel like doing it because I'm feeling the results. So morning, like after my breakfast, that's the first thing I do. And I'm done with the whole day, Now, the problem, these are all the good news. Thank you so much. And the volume of my, I don't know if I should be saying this in a public forum, but we all are patients here. So I'm sure it's okay to share. So earlier I would feel that there would be a very feeble flow when I would pass urine. But now even the volume of urine has improved, and so I'm very cautious about my kidney, because I have to save that for the rest of my life. And so that also is a big improvement. I don't know what is working. Maybe everything together is working. So I have seen and felt improvement in all my health issues, like whatever I have been having. One more point, in the ankle, you have a round bone which is protruding, like this thing. That used to be the area around that protruding bone would be always swollen, like badly swollen. That swelling has reduced by 50%. If anybody wants, I'll share my pictures before and after, because I have taken photos of my feet with the swollen ankle. And now how it looks, I can give evidence, I have proof. Now, one thing.
So sorry, due to time shortage, I had to stop the video. We will be sharing the same video in the webinar group, so you can see it at your ease. Meanwhile, we'll take up the questions. So kindly write your questions, your health issues along with your number, and we'll take them up one by one in the limited time. And whatever's left, you can write in the webinar group and we will answer it shortly. Thank you, Bela ma'am, and all the best in your onward journey since you've already enrolled. Please write your health issues and name and number so that we can address your questions properly and on personal, we can send you all the videos of Swamiji so that you can see at your ease. Anuja Shah, ma'am, once we learn, we need to practice every day. Yes, the classes are going to be twice a week, and you need to practice every day to get the best results. Even when we finish the session to maintain fitness, ma'am, it is always advisable to continue kumbak, but then it depends on you totally. Is there any cure for multinodular goiter and osteoarthritis in kumbak? So, definitely there is a cure, Padmini ma'am, for osteoarthritis. This is what our base program is all about, and goiter is also something related to the vata issues. So, in our program, we take care of these are the three modules: vata, pitta, kapha in Ayurveda. So these three dosha is balanced, and osteoarthritis is also a very, very common problem addressed in Ashtaang Chikitsa. So where we work on the root cause along with the Pran Shakti diagnosis form, as Anandji just mentioned, which you need to fill up with some questions regarding your breath, etc. And Swamiji does the root cause analysis. So accordingly, you're given your customized kumbak to practice. And that's how slowly you come out of your osteoarthritis symptoms of pain, inflammation, immobility, etc. In these 9 weeks, we also work on alignment issues, which also becomes a great problem as we age. So a lot of problems happen due to the misalignment of the body as well. Anuradha Godbole ma'am, spondylolisthesis is also taken care of along with muscle weakness and severe sciatica and poor circulation. So here we are working on the lymphatic circulation as well, so that all the toxins in the body is already also released. So we give you certain detoxifying things are suggested to you during the program, which you need to take. And obviously, the muscle weakness is taken care of when we are doing the 3 modules of Vata, Pitta, Kapha, because there is some Marma Vinyasa which we are making your practice in the program along with Agnyas and Kumbhak therapy. Anuradha ma'am, if you could leave your number, so we can also send you videos and texts on your personal message. If that's comfortable, you can always do that. Is it possible to join from mid-October? So Deepa ma'am, you can leave your number and we will get back to you when we start a batch in October. So, Bela ma'am, you've already enrolled for the program. I'm a RA patient, but currently struggling with major joint pains caused by chikungunya. Please advise. So, you will see that slowly, this is one of the very, very common problems after chikungunya, that the joint pains happen. So, as you do the Ashtaang Chikitsa course with the kumbak therapy part, you will see a lot of relief in your release of toxins and the joint pain, which will get at ease after some time. So, Deepa ma'am, you can leave your number and we will make a note of it so that you can join in mid-October. We will inform you. Okay, Punya Praveen sir, I'm a patient of high BP and severe IBS and a lot of digestive issues, arthritis and inflammation in whole body. Will kumbhak help? Definitely, sir. Kumbhak is definitely going to help. It is the key, because IBS, irritable bowel syndrome, is again a very, very common problem. High BP will be stabilized with doing kumbhak, because you have to do kumbhak according to your body's capability and not force the body. A lot of digestive issues, so gut issues are also issued with the pitta module. inflammation and arthritis. These are the main things that we cover in Ashtaang Chikitsa. Inflammation, why the inflammation? That is what we work at when we are doing the Pran Shakti diagnosis. The root cause analysis. What is the reason for the inflammation in the body? Balu Ramamurthy, is this only for pain management? Does it cure issues like thyroid, cholesterol, BP, etc.? Are these like side benefits of the primary focus as well? Very correctly said, Balu Ramamurthy, sir. So thyroid, cholesterol, BP are the side benefits of the primary focus of the Ashtaang Chikitsa program. So as you're working on it internally, you will see all these issues are also solved along with your pain issues. So you can leave your number if you would want us to share more videos on Swamiji and testimonies. Thank you so much, Padmini ma'am. So, Padmini ma'am, I've sent you all the details in the webinar group. I think you have been asking for the one-on-one session discount. I have Maria ma'am, I have RA and other diseases like thyroid, uric acid, vitamin D, and diabetes. So, rheumatic arthritis again is an autoimmune condition. And as Balu sir just said, these are the side effects of the main program. All these are also taken care of, though this is not the primary focus. Thyroid, uric acid, and vitamin D absorption is greatly enhanced by doing kumbak. Once you do kumbak, your calcium absorption, vitamin D absorption is far better. Diabetes, of course, this is again taken care of, but this is not the primary focus. So since we are dealing in neuromuscular health issues, so RA would be the main focus, and you would see that slowly, even these are controlled. So if you can leave your number, then we can send you testimonies and videos on Swamiji. So Payal Goyal, ma'am, please leave your number. We can keep it noted and then intimate you whenever we start in October. Devan sir, please leave your number if you want us to send the video presentation. This will definitely help in the raised uric acid levels because again, as we work on the root cause, that what is the reason that the uric acid levels have increased. And eczema and sugar, of course, this is not the primary focus, the sugar. Eczema, whenever something is on the skin, it's because the liver function is not proper. With the proper kumbhak breath ratios, obviously the eczema part would be taken care of along with sugar. Payal Gohil, ma'am, I have an early stage of osteoarthritis, osteopenia, which detected in my early report. So, Payal, ma'am, I would suggest that you join the program because you're mainly dealing in osteoarthritis. And since it's an early stage, you will be able to reverse it very soon. So, Neena Jaitha, ma'am, I have overlap of Crohn's disease, lupus. With this help, I have inflammation, joint pain, and fascia pain and weakness. So all these that you have just talked about, Crohn's disease, lupus is again an autoimmune condition. And these are taken care of under the hat of Ashtaang Chikitsa. Because as you heard in the Swamiji's video, you have to do the generic program for 9 weeks by balancing the 3 dosha of Vata, Pitta, Kapha. And once the 3 dosha is balanced, we do a Pran Shakti diagnosis to work on your symptoms. And according to that, the breath ratio is changed. And Swamiji gives you a customized kumbhak to take care of all the problems that you are suffering from. Does the class involve yoga asanas, that is physical exercise, only pranayam, that is breathing? So there will be some movements, Balu sir, as the name suggests. It is about muscular issues. joint pain. So we need to make the movements, right, for the circulation to happen. So along with kumbak, we make you do certain movements for alignment issues as well. Everybody, whoever's giving their number, please give your WhatsApp number so that it's easy for us to connect with you. Need to talk directly to one, please. Jamila Kasir, can you please leave your number so Neha from our team would connect with you tomorrow morning? Thank you so much, Jamila ma'am. So Neha from our team will connect with you. Anybody else from the participants who would like to ask their question? Please do not hesitate to ask your questions. Whether you join the program or not, that is your decision. It's about your health. So whatever comes to your mind, please ask without any hesitation. We are here to help you all to come out of your health issues. Where is your location? Our registered office is in Pune and Swamiji is located in Delhi. So anybody who would like to ask their question, please do not hesitate. And do not wait for somebody else to ask a question that will not solve your problem. So please take the courage to ask your question about your own health so that you can come out of it very, very easily. Since kumbak is a very, I think, new thing, nobody else is reversing diseases through kumbak. Swamiji has taken the initiative to find out and do a lot of research. And he has come out with this beautiful program where you can easily come out of your health issues by practicing kumbak. Nishi ma'am, we will be sharing all the details in the WhatsApp webinar group. So you can pay through the payment link, share a screenshot, and then we will tell you how to proceed. Yes, Nishi ma'am. You can raise your hands also if you want to ask your question. Nishi ma'am, if you could switch on your camera, please.
Yeah, can you hear me?
Yes, ma'am.
Yeah, actually, I just asked you. No, my husband is actually having this eczema issue,
Okay.
and it's localized eczema. So, will it really help with this type of
Yes,
kumbak?
definitely. See, whenever anything comes on the skin, that's when, it's a last, like when your liver function is like too damaged, then only it comes on the skin. So, accordingly, Swamiji is going to do the Pranshakti diagnosis and he will give you, your husband, the breath ratio so that he can get rid of the eczema.
Okay. In the kumbak, do we put these Mool Bandha and the Jalandhar Bandh, Udyan Bandh, these bandhas are applied? Or how do we actually, like, I really don't know about it.
So don't worry, ma'am. We can like the bandhs are there, mainly the Mooladhara that is there, not the Udyan bandh and all. So this is very different from the normal, pranayams that you do. This is therapeutically designed, and particular breath ratio is given according to your problems. So this is not a general class. It is very much, designed with a lot of focus in what is your particular problem.
Yeah, actually, what has happened is, even though I do the art of living breathing, I am an actually an art of living teacher, but I feel that
Okay.
with age, we need a structured program which can help us, with our existing health issues, as we
So
are like approaching 50s and above. So uh,
So
I
this
feel
is
that,
very much a structured program in the sense that first 9 weeks is your general, learning time. So
okay.
then you learn the kumbak practices because kumbak is new to many, maybe not for you because you've been into art of living and stuff. So it is new.
Mhm.
First, it gets difficult for people to even hold their breath.
Yeah,
So
yeah, I
once they learn for 9 weeks, then it is customized.
okay.
So particular breath ratio is given. So then it is actually not a general program. It is very much structured. So we have
And
three modules
for
of
the
Vata,
daily
Pitta,
practice,
Kapha.
once we learn it, daily
Hmm.
practice, the breathing time is for 1 hour every day.
See, normally it depends on your speed, but 40-45 minutes is good enough.
Okay. So even after once the program ends, we should do this practice for 45 minutes.
Preferably, ma'am.
Okay.
Preferably.
The thing is actually to dividing the time to doing some yogas, doing some breathing, and then your other things also. It sometimes becomes difficult actually.
It definitely does because of time constraints and practical issues because people have to go for work. So then we say,
Yes.
our entire program, you can divide it into two parts. Do maybe a part of it in the morning and a part of it in the evening. That way also you can do.
Okay. Thank you for answering this question. Thank you so
Thank you.
much.
Thank you.
Thank you.
Nina Jaitha, ma'am, my daughter is young, has slip disc tissue, L4 and L5. She has a disc bulge and in pain for last 3 months. Can this help? Anilji, would you be answering this question?
Uh, can you repeat the question, please?
Yes, my daughter is young, has slip disc issue, L4 and L5. She has a disc bulge and in pain for last 3 months. Can this help?
Uh, can I know the age, please? Age of your daughter? 31 years. Okay, great. Yes, see, we'll just explain it in a bit more detail. Like, like I told that how Swamiji does the Pran Shakti diagnosis, he finds the weak functional strengths in your body. And what we mean by functional strengths, I'll just explain. There are 84 forces through which our organs and this whole body works, right? We'll take some examples so you understand better. We all know that gravity pulls us down, but how are we able to grow tall against gravity? How are trees able to grow against gravity? And how are birds able to fly against gravity? There's a force called Udan Shakti. Udan comes from the word Udan, to fly. So every living organism has this force inside which makes them work against gravity. Now, when we talk about the spine, we'll take an example so you understand. If you take 33 small stones, 33 is equivalent to the 33 vertebra. And if you drill a hole through all those stones and pass a rope through them, if you want to keep the stones to be in one straight line, you'll have to keep the rope pulled at both the ends. Now, this upward pulling force is the Udan force. The downward pulling force is the Apan force. So, when any problem in the body is related to the spine, whether it's disc bulge, disc slip, cervical, lower back pain, tailbone pain, is the problem of the Apan and Udana Shakti. So through this diagnosis, Swamiji will able to determine, and like you just told that these are the problems, so we can straight away say that these are the problems of the weak Vyan or weak Apan or Udana Shakti. Through these Kumbhak practices, these forces or these Shaktis can be strengthened, and once these are strengthened, the problem vanishes. Whatever the label have the doctors have put, be it disc bulge, disc sleep, or whatever label, if the spine is strengthened, and what are the things that keep the spine straight? The Apan or the Udana Shakti. So that's how you come out of the health issues related to the spine. And in the same way, a lot of so when Swamiji does the diagnosis, he he can find out the weak functional strength. Out of these 84 forces, which force has become weak? One or multiple forces. Then he customizes the Kumbhak practices. He'll give you custom practices in the 10th week. I hope it answered your question.
Anybody else who would like to ask their question? I'm sure somebody has some question working in their mind, something that you would like to ask. Some curiosity, what this is all about, anything that is coming to your mind. Just waiting for your questions. No? Nobody?
Do you have a place to join for this wonderful program? Uh, no, as of now, there are no physical places because this was started during the Corona time, and what we realized is that it's much more economical, and people from all over the world can join this because opening a center is in resource intensive, and which translates to bigger fees for the program. Now, people from small villages in India, now you are uh, in the Gulf now, but through technology, you are able to listen to us and do the program. So now it has been kept like this only. But if in future something comes up for a offline session, we'll definitely let you know.
Anilji, tinnitus can be solved.
Yes, yes. Tinnitus is related to the nerve problem. So, and since this program takes care of all types of neuromusculoskeletal problems, it is addressed very easily. Tinnitus is something which you get a cure of very easily. Can we send a question to you directly for privacy? Absolutely. I'll just share my number.
I've given my number. I've given
Okay,
my
great.
number.
Okay, great. Because somehow I'm not able to see any chats properly and not able to post the program details also.
So nobody with any questions?
Can you share the number again?
Yes, sure. I'll share the number again.
Mhm. Age limit 16 years and above. There's no upper age limit. The maximum age of one of our participants was 94 years, and 70, 80 are normal in our program. 70, 80 years of age. There's no upper age limit, only lower age limit, which is 16 years. If there are kids below the age of 16 years with some ailments, then there's a special program for them because during these 16 years, their organs are still developing. So they have to be treated in a different way. And this program is to be done by 16 years and above. Can the family members do together? The fees is separate. Yes, since the diagnosis will be different, so the fees has to be paid separately, and family members, additional family members, there's a 20% discount on the second, third, and you know those enrollments.
I've just been diagnosed with bursitis knee due to fall 7 weeks ago and ligament injury. Right knee also fall year ago. Do I need to heal before doing the program?
Uh, this program will heal. Because any kind of ligament tear, by normal traditional treatments, it takes a longer time. But with kumbak, it's really fast. The only thing is, if you undergone a surgery, there shouldn't be any surgical cuts on the body while doing kumbak. The surgical cuts on the body needs to be healed. Internal injuries, that's not a problem, because this in itself is healing. And since regeneration factor increases, so it's more, all the more important if you've undergone any kind of surgery to recover faster. This is advised. Kumbhak is advised, because more the regeneration, faster the healing. All right, so we just have 5 more minutes and then we'll end this session. So if you've got any question, you can ask, or later on also you can post in the WhatsApp group. Can you explain in short what kumbhak is, how we do for breathe, and how we do for breathing? See, in simple, in one sentence, kumbhak is the body's strength creating ability or mechanism. I think you missed the uh, initial part of the webinar. You can watch the recording, but you can do an experiment which Swamiji made you do in the video that we played. If you just keep your palm like this and push against this palm with as much strength as possible. Just do it now. Payalji, you can do this. When you push anything or pull, you can pull with as much strength as possible. Your breath gets held. Do this experiment and just let me know in the chat. Did your breath got held? Yes. Whenever we start applying force, whenever we start doing any work that requires strength, the body holds the breath automatically. Without holding the breath, the body cannot create any kind of a strength. Now, when we talk about any disease, any chronic ailment, can we say that something has become weak inside the body? And what is inside the body are the internal organs. So there's internal weakness in the organs. Now, if we're saying that to apply any kind of strength, to create any kind of a strength, breath gets held, but these are involuntary action. These are voluntary actions outside the body, external to the body. But internally, all the organs are working on their own. All functions are involuntary. When you sleep, your heart beats, your breathing, everything is working on their own. You don't do anything consciously. So through these kumbhak, these are formulas. By formulas, we mean there's a count. There'll be different kumbhak formulas. Like every week, new formulas will keep on adding to your practices. There's a count to which you have to inhale, hold, and while closing the eyes, there'll be focus points. Where all will you be focusing? while holding the breath. Then there'll be a count in which you have to exhale. And in some of the kumbhak practices, again you will be holding after exhaling. There's a count. So through this count, if you look at the science behind this, you are giving an epigenetic trigger to the internal organs, to the stem cells of the internal organs. And if you know, stem cells are what starts the regeneration. And kumbhak is the only method that can do that. So once these stem cells get a trigger, the regeneration factor of the body starts to increase. And once that increases, the organ starts gaining strength. And once it starts gaining strength, the function becomes normal. And whatever the label doctors have put on you of a disease, that vanishes. Actually, kumbhak has nothing to do with any disease. It's all about strengthening the internal organs and then functioning. And because all the organs are connected with each other, so once an organ's function is disturbed, so does the function of the other organs. And in the same way, the healing occurs. Like in any kumbhak program, metabolism is the first thing that is strengthened. And like we know that most of the problems are metabolic disorders. So one by one, when you start correcting one organ, the related organs also start functioning normally or start getting corrected. This is Kumbhak, but for more clarity, you can watch the recording of this webinar. Kumbhak is Indian word. What is, where did that question go? What is in English, please? To hold. To hold. Like in this therapy, since we are holding breath, so we call Kumbhak is breath hold. But it can be holding of an emotion. This whole universe is doing Kumbhak. Like this solar system, every planet is maintaining its place. They are not colliding with each other. So it's a kumbhak. It's a hold. They're holding their position in the universe, in the solar system. So kumbhak literally means to hold. But since we are holding breath in this therapy, we call it's breath hold. Can kumbhak help in lowering cholesterol? First of all, cholesterol is not a bad thing. And we'll share video of Swamiji in the WhatsApp group. If the body needs cholesterol, then it is good. If it doesn't know, so kumbhak works like a voltage stabilizer. If something is higher, then it brings it to normal. If something is lower, it brings it then again to the normal levels. It works like a stabilizer. I've told it in very layman terms. So that's what it does. It builds strength in the organs, and when the strength is built, there's a balance, the balance in the function of the organs. The functions improve, then there's a rhythm to everything. A rhythm in the all the organs working together, and that's how the healing happens. It works at a lot of levels. Actually, Kumbhak is not just about affecting a particular organ. It increases the mitochondria density in the cells, and as we know, mitochondria is called the powerhouse of the cells. So as soon as you do Kumbhak once or twice only, you'll see a surge in energy, and this energy maintains throughout the day. That is one thing. Then at the same time, the it works very fast on the inflammation, and the inflammation is the cause of the pain. So when you do Kumbhak and within a few sittings only, you see drastic reduction in the pain factors. Then it strengthens the metabolism and digestion improves, sleep improves, and it works on multiple levels at the same time. And then regeneration factor, it gives a trigger to the stem cells, so it works on the whole body. This is completely different from whatever you may have tried. Can misalignment be cured with kumbhak? Are you talking about the structural misalignment? There's a part in this program in which the structure of the body is aligned. There are three basic alignments of the body: inner thighs, navel, and the chest. There'll be special movements which you'll be doing along with kumbhak. because there are a lot of issues that happen due to a misaligned structure. Like sciatica is one of them, and there are a couple of other issues also due to a misaligned structure. That is built into this program only, the alignment of the structure of the body. Shoulder, yes, that will be taken care of. All right, so we've exceeded our time now. So last question we can take if anybody has that question. Otherwise, we'll end this session. All right, so no more questions. Thank you everyone for attending the session. I hope you got some insight and a different perspective, different understanding about the body. And we also understand that this is something new to the world, but people are getting exposed to kumbak, its effects, its benefits. May I have your mobile number, please? Yes, sure. I'll just put it in the chat. So you still can ask questions in the WhatsApp group after the webinar tomorrow, day after, so that you get more clarity. And in the meantime, we'll share a lot of testimonial, a lot of information in the WhatsApp group itself. And with this, we come to the end of this session. Good night. Have a great time. All the best to all of you.
Thank you so much to all the participants who's we'll be taking up the questions in the webinar group as well. So you can put your questions there. Thank you so much. Namaste.